Good evening, good afternoon, good morning to all of us. Let me just share my screen. Just a disclaimer. All the opinions, views that will be shared by the presenter, so everything that I will be sharing are purely my own opinions, views, and does not represent the views and the opinions of the organizations that I represent. At the same time, all data and information that will be private that will be shared in this presentation are publicly available, and no confidential or privately acquired information will be presented in the succeeding slides. Yeah, for this presentation, so I expect this to be around 30 to 45 minutes so that we can still have time for the reactors and for the questions and answers for the Q&A. So the agenda will be as follows. Number one, I would like to discuss a very brief COVID-19 context. And then number two, I would like to share to you the problem that the Philippines faced during the early part of the pandemic. And then number three, and the main part of my discussion will be on how we were able to operationalize standards and interoperability and how we were able to use them as part of our response in COVID-19. And then number four, I will share to you the next steps that we are planning to do. And number five, I would like to share to you, I would like to summarize the role of standards and interoperability with regards to the Philippine COVID-19 response. So, I think every one of us are very aware that we are currently in a pandemic. So since the first confirmed case of COVID-19 was recorded in December, there are now over 75 million cases worldwide. And even if we already have the vaccine, it is projected to rise over the next few months. So I think for many of us here, COVID-19 is a real problem that we are facing. And in the Asia Pacific region, our region is one of those that was affected heavily by the virus. So the Philippines, so currently we have around 450,000 cases of COVID-19, and we are the seventh country in the Asia Pacific region. So it's not a it's really a problem that we are that our country is facing right now. So although COVID-19 is a health problem, it has also become an economic problem for us because of COVID-19 we are experiencing lockdowns and we are experiencing economic recession. So COVID-19 has been a big problem for our country. And because of that, so during the early days of the pandemic, so around January, the Philippine government has operated the Philippine Interagency Task Force on Emerging and Infectious Diseases, or the IATF. So the IATF will serve as the policy-making body with regards to decisions pertaining to the Philippine government's response against the COVID-19 pandemic. So what the Philippine government did was it created an interagency body. So it is not only the Ministry of Health, but it is composed of almost all of the different ministries in the Philippine government, and they put together an interagency task force that will create the policies that will be done regarding decision on the Philippine COVID-19 response. And one of the key resolutions for the IATF is it has decided that we should be using science in decision making. So all the major decisions that the Philippine government will do, so whether we will have a lockdown or whether we will have a quarantine, all of those will be based on science. So, in order for IATF to make decisions that are based from science, it has implemented data modeling tools. It has used data modeling tools to support those decisions. So in the Philippines, before the government declares a lockdown on a particular area, there are data models that are being used to determine whether a lockdown is necessary or not, or whether restrictions are necessary or not. So it's not something that is just being done quickly. So there are data models that are being used. However, in order for us to ensure that the data models are useful, there is a need for real-time data. So we are all aware that data is important, and for us to use them in a meaningful manner, we should have real-time data. So that is now a problem. Why? During the early days of the pandemic, so before the lockdown was implemented in the second week of March, I think that was March 17. During that time, according to the official confirmed cases, there were, according to the official numbers, there were only 187 cases of COVID-19 in the Philippines. So that was during the early days of the lockdown. So the decisions then were made based on the knowledge that there are only 187 confirmed COVID-19 cases in the Philippines. But actually, 8 months later, when the Ministry of Health was reviewing all the data that came in, they actually realized that during that time when we had the lockdown, there were already 5,000 COVID-19 cases in the Philippines at that time. So that is a problem because government was deciding based on the information that there were only less than 200 cases, while in reality, there were already 5,000 cases at that time. So there was a mismatch in the data reported versus the data that was of what was actually happening on the ground. And why is this happening? So they did a this data was available later on, but they did a study, and what we found out was from the time a COVID-19 a person had symptoms to the time his data was confirmed by the Department of Health, it took 44 days. That's very sad because ideally it will only take 2 to 3 days before from symptoms up to confirmation. But during the early days of the pandemic, it took them 44 days to confirm results. So from the time there were symptoms to the time the swab was done, it already took 13 days. And then from the time the swab, the RT-PCR test was done, to the time the result was released, it takes another 9 days. And from the time the results are available in the lab to the time the case is confirmed by the Ministry of Health, it takes another 22 days on the average. But that's the reason why we have this scenario where we have 187 where we have 187 official cases, but actually we have 5,000 cases already. So there was really a huge delay um, in the flow of data from the ground to the central reporting body. Well, of course, this is not just an IT problem. During the early days, there were very limited tests that were done because I think our labs were only capable of doing 100 or 200 tests per day. So there's really an issue in the number of tests. There's really an issue in the knowledge of people. So before they go to the hospital, they have to experience a lot of symptoms first. Unlike now, when you only have cough or you only have cold, you already take the swab test. So before, it was really a problem because there's lack of knowledge about the disease. There's a lack of testing that was being done, and it was very hard to confirm results because there were very few contact tracers. So those were the problems that were being faced during the early days of the pandemic. So, as I mentioned earlier, one of the things that was done was to use various information systems for COVID-19 response. So this architecture, the architecture that I am showing to you right now, was one of the earlier versions of the architecture that we had. So in the national government alone, I think we were using around 13 or 14 information systems. So we have a case management system. So the one in the middle is the case management system. So the name of that is COVID Kaya, so this one. And then, sorry, um, let me use the pointer. So we have a case management system here. We have EMRs. We have symptom reporting. Of course, we have contact tracing. And then we have a different set of systems for the lab. We have a system for data analytics. And we have a system for the health insurance. So we have around 13 to, I think, 14 information systems that are being used nationally. However, the problem is these are not integrated during the early days of the pandemic. So it is very hard to share data from one information system to the other. So if we will be reducing this number, if we will bring this down, we should be able to make this architecture integrated. So in order to implement in order to implement ICT in the COVID-19 response, the Philippine IATF organized the sub-technical working group on ICT, and it was headed by the Department of ICT in the Philippines. And under the sub-technical group in ICT, there were five. Well, right now there are six, but earlier there were five work streams. So there's a work stream on contact tracing. There's a work stream on data quality because there's a lot of data quality issue in the data that was submitted from the ground up. So we had one work stream on that. There's also a work stream on data analytics because we realized the importance of using data to make decisions. So we had work stream number 3 for data analytics. We have a work stream on process and systems integration because as what I mentioned earlier, there were around 14 information systems that were being used. So we need to ensure that all of those were integrated. And then we also have a work stream on compliance and sustainability. Because we know that after COVID-19, whatever we have can be used by the government. So we had 5 work streams. And I think the focus of our presentation today is workstream number 4, which is process and system integration. So currently, as mentioned by the announcer earlier, I am the project manager for workstream number 4. So I am the one heading the integration of all the clinical systems that are being used for COVID-19 response. And then, after the establishment of the ICT group, in one of the decisions of the Philippine IETF, again, the Philippine IETF was the decision-making body for COVID-19 response. And in one of their decisions, they adopted the use of HO7 Fire as the interoperability standard for COVID-19 response. So there was a decision by government to use the HO7 Fire standard. And this is the first time that the Philippine government is actually adopting this standard. So because of that, Hill Asia, so our lab was brought in to support the Philippine IATF. Number one, to provide expertise in the use of HO7 Fire, because we have expertise on that standard. Number two, we help the government to set up tools that will be used to adopt HO7 Fire. So I will share it to you later. Number three, we will be the one leading workstream number 4. So again, as I mentioned earlier, workstream number 4 is end-to-end process and system integration. Number 4, our main goal was to ensure that all the systems in the ecosystem are integrated. And number 5, we reviewed the architecture and we modified it to optimize the processes. So we reviewed this architecture to make sure that this will be optimal. So what were the challenges that we faced when we implemented HO7 Fire? Number one, and this was the biggest challenge, most of the applications that were used are not familiar with HO7 Fire. Because again, HO7 Fire is a new, it is the first time that it is really coming in to the Philippines. So many of the applications were not familiar with the fire standard. Number two, the application. So we have 13 applications. All of those were developed by different programming teams. So imagine you have 13 applications and you have 13 programming teams that are developing those applications. So it is quite challenging to integrate to make sure that they communicate properly. Number three, since we were on a lockdown, all the work were done virtually. So even up to now, I haven't seen physically the people who I have been working with for the past 8 months. So everything was done virtually. Number four, there is no governance structure. Well, when we say there's no governance structure, when Workstream 4 was established, there's really no organization. So they just asked me to be the project manager, and after that, there's nothing under me. So I had to organize a charter, I had to schedule weekly meetings, I had to organize the group to ensure that we will be able, again, we are talking about 13 development teams. So I had to organize them so that we will have some form of organization or governance. And the thing that I always remember is the gaps of AHIN, because number one, there is governance. So that's why I felt that it is very important to set up governance first. Number five, we are in a very robust environment, and in this environment where you don't see the person you're working with, where you need to integrate 13 applications in a span of 2 months, there's really no standard way of doing that. This is the first time that you need to work with them, and then this is the first time that you need to do something for the next 2 months. So that's really a challenge. And number six, there's no KPIs, there's no key performance indicator, so we don't know whether we are succeeding or not. So those were the challenges that we had when we first um, started with the integration of the systems. So the first thing that we did, and our lab is really good at this, is to do capacity building. We have to increase the capacity of the various applications so that they can work with fire even though they are not familiar with it. So how did we do that? Number one, we launched a YouTube channel. So we uploaded fire tutorials so that we will be able to increase the capacity quickly. So I think later on I can show to you the YouTube channel that we have where we have the various fire tutorials that we made. Number two is we had peer-to-peer meetings with the various developers. We are talking about 13 head of developers here. So we had to organize meetings with them to determine whether they are ready already to use fire. And number three, we provided service support. Whenever they encounter an error, whenever they have problems, they just contact us and we will provide support. Because during those times, there's no time for them to search the internet for solutions, or there's no time for them to take a fire developer course. So what is important then was for them to be able to program quickly. If they have a problem, Hill Asia should be able to provide support immediately. So that was on the training part. And then we do the teaming. Number one, we use fire to model the whole COVID-19 workflow. This was an interesting problem because there's no fire model for COVID-19 yet at that time. So we had to do the fire modeling by ourselves. And luckily, so we did the fire model and then we used that. I think last month, the OpenHIE group released a fire modeling of the WHO case investigation firm. And you know what? The model that we did is almost similar with the one that was done by the OpenHIE community. So it validated that what we were doing was actually correct, which is at least good. At least we were on the right path. Number two, we had to collect the data dictionaries of all the COVID-19 information systems because each COVID-19 system will have its own dictionary. So we had to collect them and we have to map them with the COVID-19 with the fire model, because if we will not map them to the fire model, then they will not be able to share data with one another. And we, Child Asia, need to do that because we were the ones that was really familiar with fire. If we ask the developers to do that, it will take them a lot of time. So we had to do that in order to support and in order to make sure that the process was faster. We also developed an implementation guide. So an implementation guide is basically a guidebook on how H07 fire will be adapted by the different developers. So I will be sharing with you. Let me share with you the implementation guide that we did. So I'll quickly pull it out. And this is available online because we want all the applications to be able to use it. So the idea with the implementation guide is it describes, it describes how fire will be used in for the COVID-19 response. So we have the patient, we defined what a patient is. So we had a sample JSON for the patient, and we already localized this for the Philippine context because H07 Fire has 160 resources, and we don't have time to study all of those resources. So what we did was we localized and we identified the resources that are needed for COVID-19 response. And for each of the application, so here in the left side, for each of the application, we had their own documentation. So we had the resources that are being used by one application, so that for developers, it will be easier for them to see how they will be sharing data with the other application. Number 7, we developed fire extensions because, again, we need to localize fire. And there are some terminologies, there are some fields in the Philippines that are not yet modeled in fire. So we needed to extend fire in order for it to be more useful. Next, tooling. We withdraw the architecture to ensure that 807 fire can be adapted easily. So from this architecture, so from the one that we had earlier, this one, we redesigned it to be like this. And as you can see, there are fire servers in that architecture so that it will be easier for fire to be adapted. We also developed a CSV to fire conversion tool. The CSV to fire conversion tool is a tool that converts Excel file into fire resources. Why do we need to do that? We needed to do that because a lot of health facilities in the Philippines are still using Excel spreadsheets to record data. And they are not using any application. So what they do was they record the data using Excel, they email it to the Ministry of Health. The Ministry of Health will encode that data to the central surveillance system. And that alone will take weeks to finish. In one LGU where we were working with, they have a backlog of 16,000 records. So they have a record with 16,000 data in Excel. And those data are not yet placed in the main surveillance system. So for us to make sure that that will be placed, that will be submitted quickly, and since the main system is using Fire, what we did was we developed a tool. It's a lightweight tool, and what the tool does is it reads the CSV file, and then it converts it to JSON, which is being used by Fire, and then it pushes it using the Fire API to the main system. So in a matter of 2 days, we were able to submit the 16,000 data that was left in that LGU to the main system. If we did it today, it will take them at least a month to encode it. So that was quite helpful. And then another thing that we did was, again, I mentioned earlier, there was no integration workflow because this was the first time we were doing this. So what we did was we organized a workflow. So all the applications that will integrate to the system will use the same workflow. So number 1, if you want to integrate to the system, you have to provide with us your API documentation. And that is the first step. Number 2, if you want to integrate to the system, number 2, we will need to map your data with the data dictionary. Number 3, of course, you will need to modify your system so that you can use the APIs, so that you can use Fire. Number 4, we will do integration testing. So Scylla will test your application. And number 5, so after we have done the 4 steps, that is the time when technical integration is achieved. So for every application, for every integration, we followed the same workflow. For testing, Hill Asia, our lab established a test server that allowed applications to test prior to going live. And number 3, we reviewed or we do peer-to-peer coding with the various applications to ensure that faster development can be done. And then another problem that we had was we had we don't know how do you measure integration. How, like, there are 13 applications. Of course, the goal is at the end of the day, all of those 13 applications are integrated. But how do we report it? How do we tell if we are getting near our target? So the initial parameters that we were looking at was number one, we look at the percent of integrated applications. How many integrations have we done? But we realized this is hard to monitor that because integration is being done not only by one team, it's done by two teams. They will integrate together. So it's it's not it's not easy to say whether they are integrated or not, or it's not easy to use it as a parameter. Another parameter that we considered was percent of data shared. But again, we realized it is not very useful for us. So what we did to monitor the systems properly was we developed a scoring system. Remember earlier, I mentioned that there were 5 steps for you to integrate with the ecosystem. So we have here the five. So we have here the 5 steps: 1, 2, 3, 4, 5, and then we have here the various systems. So EMR to COVID kaya to EMR. So we have here the integration. So for each for each arrow here, okay. So for each of the arrow here, it corresponds to one row. Okay? And then, for example, we are integrating EMR and COVID Kaya. Number one, we look. Have COVID Kaya already provided the API documentation to the EMR? If not yet, then the score will be 0. If yes, if it is in the process of doing that, the score will be 1. And if it has already completed that, the score will be 2. So once you have get a score of 2 here, you will move to the next step, mapping of data dictionary. So again, we will score it 0, 1, 2. And during the first time we set up this scoring system, the total integration score that we had was 3. So the maximum score is 10. But the total score that we had, the average of this is 3. So what does it mean? It means that the systems are not integrated. If you will see here, there's no integration that has been done yet. The only applications that have modifications, so they have already finished their modifications, but we were still testing them. So during June 2020, the average integration score that we had was 3. We had weekly meetings, so we met them in a weekly basis. And we followed up, and then we made sure that they are working well. And by October 2020, we already had an average of around 9.8 out of a out of a maximum of 10. So what does it mean? We were almost 98% integrated by October 20. So from June, where we were at 3, we were already at 9.8 in October. So that was good. So we monitored our progress weekly. So when we started, we were here at 3. What we did was for every month, we set a target. So we said that by the end of July, we should be at 6. And we achieved that target. And then we said that by the end of August, we should be at 8. We achieved that target. And we said that by the end of September, we should be at 9. And we achieved that target also. So I think we were only missing the one last integration. And then once we have completed this, and then we should have been done already. But this is a work in progress because we should be working with, this is with LGU, so we should be working with 1,600 LGU. So it will never be 10. because we need to finish those things for us to get that 10. But I think 9.8 is already a good score. So what are the next steps that we are working at? Number one, we are planning to expand the ecosystem. So we have this ecosystem here. So we have here a contact tracing data warehouse, and we are planning to integrate 27 contact tracing applications. So before we were working with 13 applications, now we are talking with 27 contact tracing applications. But we are confident that we can finish this by early next year because we already have the policy on that. And we already had the experience of doing that with the 13, so I think the 27 will be a little bit easier. So what were the key ideas that we got from this experience? The use of 807 for contact tracing data is something we are looking at. I think this is the first time that 807 will be used for contact tracing data. So that's one thing. Number two, we are planning to employ the same method, so the 5 steps that we had with the COVID-19 ecosystem. So that's something that we are planning to do with the contact tracing apps. And number three, we are looking at the certification process for the contact tracing apps. So those are the key ideas. So maybe before we continue, it is good to discuss what is the impact of an integrated ecosystem. So we were able to increase the integration score from 3 to 9.8. So what's the value of that? Before I answer that, I want to make a disclaimer first. The improvement in the COVID-19 response is a joint work of a lot of people. So this is not just an IT work, okay? So the reason why we will have faster testing is because there's a lot of testing that is being done now. The reason why it is faster to validate data is because there's a lot of contact tracing applications now. So the integration that we have done is not the only reason why we have a better COVID-19 response. The integration is only an enabler. We were able to support the bigger work. Okay, so so I think that's a disclaimer that I want to share. So what's the result? In early March, as I said earlier, it took 44 days from the time the onset of symptoms to the confirmation of the case. 44 days. Right now, as I was looking at the data during the weekend, it only took 6 days. So people right now, after they feel symptoms, so if they have cough or they have cold or they have fever, they immediately go to a health facility. And so the average time is from the time they had symptoms to the time they have their swab test. It's only 2 days now as compared to 13 days. So from the data that I saw last week, it only takes you around 1 day to have your lab result. And this is a big improvement from the 9 days, from the 10 days we had during the early days of the pandemic. So now it only takes you 1 day. So, and well, I want to emphasize, the biggest reason here why it is very short is because we do a lot of testing now. Before, we only have 100 tests per day. Now we are doing 30,000 tests per day. So it's really a lot. And then, from the time the results were released to the time the data is confirmed, before it will take you 22 days. Now, because of the contact tracing applications that we have, we only need 3 days. Okay, so in total, from 44 days before, it only takes 6 days now from the symptoms to confirmation. And this is still not very good. The target is 2 to 3 days. How do we do that? We still have to reduce the confirmation, the time to confirm. It should be less than 1 day. Okay, so we believe that once we have integrated all the contact tracing applications, we should be able to bring this down to less than 1 day. So that's the target that we are looking at. And what's the impact of this improvement? We are now seeing a reduction in the number of cases in the National Capital Region. Before, during our peak, we were averaging at around 2,000 cases per day. By now, we are just averaging around 300 cases per day. And hopefully, we can still bring it down. So I think integration had an effect on improving the days between symptoms checking or confirmation, and indirectly, it has an effect on reducing the number of cases of COVID-19 in the country. So I think I am now in my last slide. So what's the role of standard and interoperability? So it allowed the seamless sharing of data, number one. Number two, it makes it easier for developers to adapt. So Fire is a very good technology and it was easy for us to adapt it. Number three, it allowed an environment for collaboration. Number four, it allowed us to focus at the problem. So instead of focusing on developing systems, we were focusing on testing, treating, and tracing. Number five, validation can easily be done with H07 Fire. So the key takeaways here, and I want to emphasize the AHIN mind the gap because we have been at the center of our response. Number one, governance is important. When the Philippine government decided to use H07 Fire, that's a very big thing. Number two, architecture is important. The architecture that we have right now is it made our life easier to do the integration. Number three, program management. So I think this is where Sail Asia came in. We were the program managers. We were the ones who talked with the various applications. And number four is standard. The standard should always be available and should be readily used. I think that's all for me. Thank you very much. And I think I'm open for questions.
Yes, thank you for the comprehensive lecture, Sir Philip. And before our Q&A session, let's hear from our reactors from Lao PDR and Vietnam. We would like to hear from Mr. Somkit.
Thank you, Ms. Chaya, and thank you very much to Sir Philip for your great presentation. Good evening to all of you from Laos. My name is Somkit. I am IT officer at Ministry of Health. I'm mainly working responsible for the HS2 Health Information System, and I have a opportunity to be in the team of COVID-19 response, mainly in the capturing system, of course. So here in Laos, we are using the HS2 a module developed by University of Oslo in Norway, and by the help of HIPS Vietnam team to configure the module into our system. So we have been using the COVID-19 module in the HS2 since late of March 2020. And right now we have 3 programs in the DHS2, which is COVID-19 case-based surveillance, which capturing suspected case as well as positive cases. And COVID-19 contract registration and follow-up. We capturing all contracts that have been, all contact that have been contact with the positive cases in here. And also we have COVID-19 test returning. All of these 3 programs are capturing in case basis, which is case by case, and we have detail for each of them. Apart from these three programs, we also have COVID treatment resource tracker, which is we track all the like Facebook bed oxygen from all of the central hospitals and provinces hospital nationwide. And also here in Laos, we have another system we call hotline, which is people can call into this hotline for free to ask information about COVID-19 if they have any symptom or they worries about themselves, so they can call to this hotline for the detail. For the infrastructure, for example, the, the database here in Laos, we are using cloud database, which is, and the system is currently using by the national level. We are planning to expand to the all provinces in Laos if there are more cases, but luckily for now, we don't have much cases. For now, we only have 41 positive cases, and around 13 cases are still active in the hospital right now. So until now, we in the national level still can handle this the situation well. So I think that's all from my part. Are there any questions? Or Dr. Tip, you have anything to add into this?
Okay, thank you, Songkit, for your say experience in Laos. I don't have any question. Maybe we can learn from the Philippine situation in the Philippines about the laboratory testing and say the result to the doctor. Thank you.
Thank you, Mr. Somkit and Dr. Tep. And next, we would like to hear from Dr. Phamtandat.
Hello, everybody. Yeah, all the topics from Dr. Phillips is very interesting because it's related to the technical. And I appeal by the deeply knowledge of the Dr. Phillips. Yes, in Vietnam, when the time of the COVID-19, we have a lot of system to collect information from the people. The first we have health declare e-form and require the own people flight from outside to Vietnam must be declared. Your information and the health status in the form, and even on the people flight from the city to another city inside Vietnam also have to declare the system. And the second system, we have a system to for the patient status of COVID in COVID-19. And the third system, we have a system to discover the COVID-19 people may be infected. Is the blue zone system, and on many systems to collect information when we collect to the data house, and we have about 100 expert data analysis expert to analyze the information from this data. and we discover the what where is important for protect and for discover COVID-19 person. And on the system is in Vietnam also interoperability, but um, uh, in fact that all the system is not follow the fire standard like the system of the Dr. Philip. And I think Dr. Philip can share and guide Vietnam about the technical and how to use the fire standard and how to develop the fire extension for collecting the COVID-19 information. And we want to adopt standard for the system of Vietnam. And if we have this kind of standard, we will require on the system related to the COVID-19 must be follow this standard is more easy for us for collecting system and analyzing the informations. Yeah, and, and by the way, yeah, I really want some and Sila and Dr. Phillips can open the online course for teaching experts from teaching staff and experts from Vietnam how to use and develop the fire resources and for the typical for the typical target. For example, for the EMR and or for the collecting the COVID 19. Yeah, thank you.
Thank you, Dr. Pantandat. I think there is no any question in the chat box, and thank you for the speaker and our reactors and all the participants today. And before we wrap up this session, Ehin would like to share with you that we are currently open for the registration for Ehin 7 General Meeting. And for more information, please visit our website. And thank you, Sir Philip and Reactor and all participants for joining tonight. And we would like to call on Dr. Bunchai to close this session.
Hello, can you hear me?
Yes,
Yes.
Yeah, thank
very
you
good.
very much, Professor Phillips. It's
Yeah.
very impressive that the Philippines has done on this. I really impressed that this is the real world implementation of what we are looking for, the standard. And I'm very happy that the CAPS framework that AHIN co-create with our partner like ADB, WHO has been kind of the actually implemented or used that in your in the Philippine case. And uh, I'm also leading the clinical lead in the standard and interoperability lab, Thailand, and we already discussing with Professor Phillips and Saila that we are going to have the workshop on the fire, and I think the Vietnam Dr. Thap Thanan Mandat and our colleagues from the AHIN could be kind of the joining on this. I think this is a good start that we are the collaboration of the interoperability lab in our region to work together and to be exchange knowledge. Thank you very much, Professor Philip, and we are looking forward to the tomorrow yeah, another very interesting webinar. Thank you. And thank you for everyone to participating that. And don't forget, tomorrow, Professor Philip are going to have another session that is very interesting. But I am now outside in the restaurant, so it kind of be not appropriate to show my face. Thank you very much.